your girl Lanice, and I'm here with another nursing video for you guys today. So if you want to follow my journey, this page is going to be about nursing school, because I am currently in nursing school and I am currently an LPN. I've been an LPN since 2014. Or if you like astrology, I talk about astrology a lot on this channel, but I most definitely talk about my journey from learning to not love myself to learning to love myself while also in nursing school and learning more about astrology. So if you like any of that kind of stuff, you know, you can follow me for those reasons too. Okay. So anyways, today I actually have a nursing video for you guys. I want to talk about what I have. I just want to give you guys some tips. If you do work in long-term care, if you plan on working in long-term care whenever you get out of nursing school, I am an LPN at a long-term care facility, and it is not the nicest one in the city. So, and I have worked at some really nice ones too. So just some tips that I have kind of learned while I have been doing this long-term care thing. Sorry if you see any flakes in my hair. I washed my hair yesterday, and the product I used flaked up once it dried, so, you know, it is what it is. I ain't really got no time to do it again. Sorry. So, tip number one. Well, first thing, let me just say this. I have realized that long-term care nurses have the reputation for not knowing their patients. And I will admit, I have been one of those nurses that don't know everything about every patient. And when you're working in long-term care, you're responsible. I think the least I've ever been responsible for on a hall while working long-term care, but not the rehab side. Rehab, you don't have that many, you don't have as many as you normally do when you're doing the nursing home side. So we're speaking strictly long-term care, not the rehab portion, because most places have both. You're normally responsible for around 20 to 25, maybe 28 residents. Depends on where you're working, what type of facility, how many stars, what their nurse to resident ratio is, all that good stuff. And depending on what shift you work also depends on how many residents you're responsible for too, because normally at night you can be responsible for a good number of residents. So I want to say it is very hard to know all of your residents. Like, it's hard to know everything. And these people have lots of diagnoses. Like, they have everything. They have bipolar, depression, schizophrenia, congestive heart failure, diabetes, cataracts, and then they have a below the knee amputation, and then they have a prosthetic, so they go to rehab. Like, it's a lot to know about these people. It's a lot to know. But if you have a resident that at least know how alert and oriented these people normally are, so you can at least know their baseline. You know, now if they're having an issue where they're not they're not acting like themselves, then yeah, it's time to go to the chart. It's time to really learn as much as you can about this patient, because you want to know what may happen. But I understand it is very hard to know everything about 28 patients. I know it is very hard, but know as much as you can. Know their normal. Know what's normal for them. Know what their main problem is. Okay, this is what landed them in the nursing home. This is what their normal problems are. You know, they're normally on 2 liters of O2, and they normally have 95% O2 sat when I'm taking care of them. So today they're requiring 4. Something's not right. Do they have a history of something? You know, just know as much as you can about your residents. But I am by no means saying you have to know every single diagnosis these people have, because it's 28 of them. They have like 8 to 10 themselves. That's a lot. That's a lot to know. I get it. My second tip for working in long-term care would be to write everything down. Do not rely on your own memory. That is me. That is me. That is what I do. Me. That is me. But I myself am trying to get into the habit of writing it down, because if you don't write it down and you sit down and towards the end of the shift you decide to sit down and chart, you're not going to remember that person's vital signs when they had a fall. You're not going to remember what their blood sugar was. You're gonna forget. You're gonna forget. So write everything down. It's right there. It's easy. It takes no time. Write it down. The next thing I would have to say is know your CPR. I know that it doesn't sound, you know, it's not acute care. These people very rarely, you might think that they very rarely need CPR, but know your CPR. Know how to give nice strong chest compressions, because you never know when you're gonna walk into a resident's room and they're gonna require you to do CPR on them. And that leads to my next tip. Know whether they are DNRs or full codes. Have that written on your report sheet and keep it up to date. Because there's no way you're going to remember every single person who's a DNR. But have a list at your nurse's station. Have it written on your report sheets. Have it somewhere and make sure it's kept up to date. Who is a DNR and who you're going to have to do CPR on if something goes wrong, okay? That would be the next tip. That'll be the next tip. And the next thing I'll have to say is know who your diabetics are. If you are on a floor, know who your diabetics are, and know if they're a brittle diabetic, know if they're a compliant diabetic, know them. Know what their blood sugars normally run, because if you know how they normally are, if they get some type of infection, you know, okay, their blood sugar is going to be higher than normal. Or if their blood sugars are starting to become higher than normal, then you might be able to say, hey, they got something else going on with them, you know, because that can be indicative of other things. So know who your diabetics are and know what's normal for them normally. The next thing I would say is try to reorder your meds. If you see that something is low and the sticker hasn't been, I don't know how you reorder meds at the facility you work at, but at the facility that I work at, each medication card has a little sticker on it, and you can either take the sticker and put them on a prescription reorder sheet and fax them off to the pharmacy, or you can still put them on a prescription reorder sheet and you can sit down at the computer and you can reorder your meds. But it is nothing more annoying for someone who, especially someone who doesn't normally work on that floor, to have to go and search through other cards for a medication because it hasn't been reordered. It's nothing more annoying than a resident who takes 3 narcotics a day, who takes 3 narcotic pain pills a day to run out of one. Then it's the middle of the night and you know the pharmacy's definitely not gonna break their back to get it to you right then. You don't have it in your backup kit, and you know you got to tell them, hey, I can't give you what you're normally used to getting right now because we ran out of it. Like, reorder your meds. Reorder your meds. Like, keep your meds up to date, please. And another tip I'll have to give you, which is hard for me, this is very hard for me because I'm not the most organized person, but try to keep your cart organized, because if you keep your cart organized and you put the stuff back where it belongs, that makes it easier for all the other shifts to keep up with everything. So just try to keep your cart as organized, or do your part as much as you can. I realize that labeling sections helps everyone keep the cart organized. So yeah, and be kind to your fellow nurses, to the people coming after you, and restock your cart. Make sure your cart is stocked up. Make sure they have enough cups, enough spoons, enough water and ice. Make sure the cart is cleaned off. Like, restock it. Do that for them, you know, because in turn they'll normally do it for you. And another thing I would say, this is just for the people that are forgetful like me, empty your pockets at the end of the shift. Empty your pockets. I can't tell you how many times I have walked out of there with a pocket full of Lancets because I put them in my pocket and go and get all my blood sugars, or I go and I have pieces of gum in my pocket, and it's just empty your pockets. Just empty your pockets, okay? Like, we use our pockets. These nursing uniforms are covered in pockets because we need them. We as nurses put so much in our pockets. We put so much in our pockets to the point that right now they have like nursing patches, like nursing bags and fanny packs and stuff to put all your stuff in. Like, yeah, so we use our pockets definitely, and we don't take stuff home intentionally, but sometimes we forget to empty our pockets. So try to empty your pockets at the end of the day. And another thing I would say is just to please be patient, and to not blow anything off. Like, not, you know, make sure that if you have to get an O2 set on somebody, just keep up with those things for people, you know. Just do the best that you can. Just always do the best that you can. Do not take the outside and bring it in the inside, and that's hard. That is so hard. And I have lost jobs because I would allow what's going on in my personal life to affect me at work. So, you know, nursing is one of those jobs where you have to be there fully 100% because you're taking care of other people, and it's not in a customer service type of way. It's in a healthcare setting, so you have to be 100% focused and there at all times when you're there. So if you can't show up and show up fully, do not show up. Don't do it, because it's not just going to affect you, it's going to affect your residents, which in turn is also going to affect the other nurses that you work with. So, you know, try to leave at home when you go to work, seriously. And that's like the hardest thing to do. But hey, you know, I'm just saying. But yeah, so if I had to give you guys any tips that are working in long-term care or thinking about long-term care work, those would be it. Another thing I would say is to learn your CNAs, because you have some CNAs that you don't have to tell what to do at all. They already know, let me get these people's vitals because I get them every day. And then you have some CNAs who act like they don't know, or you have some CNAs who will do whatever you let them get away with. They will try to get away with it. So learn your CNAs, learn how to talk to them, learn how to get along with them, but also learn how to run your floor smoothly. And I think you'll be successful. I think that's all I can really tell you guys. The only pointers that I can give you, if you work in long-term care, please comment down below any tips that you have that I might have forgotten. And let me tell you, long-term care is hard work. The workload is heavy. It is probably one of the higher ends of pay, especially for LPNs. But it is a very hard workload. The medication passes are not easy. So, you know, I just want to make you guys very aware of that before you do get into it. And these would just be the only tips that I can really think of right now. And if I come up with some more, I'll try to make another video. But my name is Lenice, and I hope you enjoyed.